How to perform a breast self-examination and use mammography to detect breast cancer early? Did you know that every woman is at risk of developing breast cancer? And the risk only increases with age. But here's the good news. Early detection can make all the difference. Regular self-examinations and mammograms are powerful tools for catching breast cancer early when it's most treatable. But where do you start? How do you do a self-exam correctly? And what signs should you be looking for? Stay with us as we explain it all. In today's video, we'll walk you through a step-by-step guide on how to perform a proper breast self-examination, giving you the confidence to check for any changes. Plus, we'll dive into the world of mammograms, what they are, how they work, and why they're super important for early detection. But first, let's understand what breast cancer is and why it happens. Breast cancer occurs when breast cells grow uncontrollably, forming a tumor. However, it's not just one disease. There are different types, each with unique characteristics. Some grow rapidly, while others develop slowly. Some remain confined to the milk ducts or lobules, while others can spread to other parts of the body. Now let's talk about risk. This is where it gets personal. You see, age is a major factor since the risk of breast cancer increases as you get older. But that's not the only concern. Family history also plays a big role. If a close relative, like your mother, sister, or daughter, has had breast cancer, your risk is higher. Genetics matters too. Mutations in genes like BRCA1 and BRCA2 can significantly increase the chances of developing breast cancer. However, it's important to note that only a small percentage of breast cancer cases are linked to inherited gene mutations. Lifestyle choices equally play a role. Factors like diet, exercise, and alcohol consumption can influence your risk. Now let's look at the numbers. Understanding the statistics can be a wake-up call. Did you know that breast cancer is the most commonly diagnosed cancer in women worldwide? According to the World Health Organization, there were 2.3 million new cases of female breast cancer in 2022. That's a staggering number. However, there's good news. While breast cancer cases are high, mortality rates are decreasing due to early detection and better treatments. Yet it remains one of the leading causes of cancer-related deaths among women worldwide. According to the World Health Organization, breast cancer claimed the lives of 670,000 women in 2022. But here's a key statistic. When breast cancer is detected early, the 5-year survival rate is often above 90%. This highlights the importance of early detection. Now let's dive into breast self-examination, how it's done, and why it matters. Think of a breast self-exam as a way to get familiar with your body. It involves regularly looking at and feeling your breasts to notice any unusual changes. The goal is to understand what's normal for you so you can quickly detect anything different. While mammograms are the most reliable screening method, self-exams are a useful way to stay aware of changes and catch potential issues early. Performing monthly self-exams can make a big difference. They help you spot changes that could signal infection, breast disease, or even breast cancer. Although self-exams shouldn't replace regular doctor checkups or mammograms, they are an important part of a proactive approach to maintaining your breast health. So how often should you do self-exams? Most health organizations recommend doing a breast self-exam every month. Consistency is key. While a self-exam alone isn't the most reliable for detecting breast cancer, it's a helpful way to stay on top of your breast health and catch lumps or tumors early. Knowing what's normal for your breasts helps you alert your healthcare provider as soon as you notice any change, no matter how small. The next important question is, when is the best time to do a self-exam? For those who still menstruate, it's best to do it a few days after your period ends, when your breasts are less tender and swollen. If you're postmenopausal or have irregular periods, just choose a consistent time each month. Choose one day each month that's easy to remember, like the first or last day of the month, and stick to it. Here's a pro tip. Keep a record of your findings by jotting notes in a journal or using a note-taking app. This helps track changes over time and provides valuable information for your doctor. Next, let's go over the 2 major steps for performing a breast self-exam. But before we dive in, if you're enjoying this video, don't forget to give it a like, hit that subscribe button, and turn on notifications so you won't miss any of our valuable health content. Now let's continue. Step 1. Mirror method. The mirror method is an effective way to check for any changes in your breasts. Start by standing in front of a well-lit mirror where you can clearly see yourself. Remove your shirt and bra for a full view. Begin with your arms relaxed at your sides. Carefully examine the shape of your breasts. Are they the same as usual? Look for any differences or changes. Look for any swelling, dimpling of the skin, or changes in the position of your nipples, as these could signal potential issues that may require further attention. Next, raise your arms high above your head. This position can help reveal changes that might not be visible when your arms are at your sides. Take your time and carefully inspect your breasts again for any changes in shape, swelling, dimpling, or alterations in your nipples. Don't rush this process. Take your time to carefully observe your breasts from all angles. For the final mirror check, place your hands on your hips and press firmly. This will flex your chest muscles and make it easier to spot any lumps or bumps that might be hidden otherwise. Lean forward slightly as you do this. Once again, examine your breast closely for any changes. Remember, you're looking for anything new or different from what's normal for you. Step 2. Manual breast self-exam without a mirror. Now that you've checked yourself in the mirror, it's time for the hands-on part of the breast self-exam. The key to a thorough manual exam is using the right technique. You can do this while standing or lying down. When standing, use the pads of your fingers, not the tips, to perform the exam. Think of it like gently kneading dough. Use a circular motion, about the size of a quarter, to feel your breast tissue. Start with your fingers flat and gradually apply more pressure as you go. This helps you feel both the surface and deeper tissue of the breast. To ensure you don't miss any areas, use a systematic approach. Begin at the top near your collarbone and work your way down using small circular motions. Make sure to cover the entire breast, from the nipple to the outer edges, and don't forget to check the underarm area as well. Many breast cancers are found in the upper outer quadrant, so be sure to pay extra attention to that area, but don't skip any part of the breast. To perform a manual breast self-exam while lying down, start by lying on your back on a flat surface, like your bed. Place a pillow or folded towel under your right shoulder to elevate that side, making it easier to examine your right breast. Place your right arm behind your head to open up the chest area and allow better access to the breast tissue. Using your left hand, begin the examination. Just like when standing, use the pads of your 3 middle fingers in a circular motion, about the size of a quarter. Start with light pressure, then gradually increase it to feel both the surface and deeper tissue of your breast. Move systematically across the entire breast, covering from the collarbone down to the ribs and from the armpit to the nipple. Now let's discuss another powerful method that is effective in detecting breast cancer at early stages: mammograms. A mammogram is an X-ray designed specifically for breasts, using a low dose of radiation to create images that can detect subtle changes, often the earliest signs of breast cancer, sometimes even years before symptoms appear. So, how does a mammogram work? During the procedure, your breast is placed on a support plate, and a paddle compresses it to get clear images. Yes, the compression can be a bit uncomfortable or even painful for some, but it's super important. It helps spread the breast tissue evenly, which provides clearer images and reduces the amount of radiation needed. The X-ray machine takes pictures of your breast from different angles, and these images are sent to a computer for a radiologist to analyze. There are different types of mammograms. The most common is the 2D mammogram, which captures 2 images of each breast, one from top to bottom and another from side to side. A more advanced option is the 3D mammogram, or digital breast tomosynthesis. This technique takes multiple images from various angles, creating a 3D reconstruction of the breast tissue. 3D mammography is especially helpful for women with dense breasts, as it can improve cancer detection in this group. So there you have it, everything you need to know about performing a breast self-exam and the importance of mammography in early breast cancer detection. Remember, early detection makes all the difference. It greatly improves the chances of successful treatment and recovery. Don't delay, take action today. Thanks for watching. We hope you found this information valuable and insightful. If you did, please don't forget to give this video a thumbs up, share it with others, and subscribe to our channel. Kindly hit the notification bell so you never miss an update on important health topics. Remember, the information provided in this video is for educational and informational purposes only. It is not intended to replace professional medical advice. Always consult with your physician or a qualified healthcare provider before making any significant changes to your diet, exercise routine, or healthcare plan. Your health is important, and having professional guidance can make all the difference in ensuring the best outcomes. Before you go, we've shared a must-watch video that highlights the important warning signs and symptoms of breast cancer. Learn about the subtle indicators that could make all the difference in early detection and potentially save your life. Click on the video showing on your screen right now to watch it, or use the link in the description below. Thank you once again, and we'll see you in the next video.